Hi guys, this is Dr. Ed. I'm here with some of my cool patients here. We're going to talk a little about ADHD and some alternative ways that most people don't think about. What can we do? How can we do things other than just pop a Adderall? So, we have Gemma, and Isabella here, and I just want them to give the experience of neurofeedback. We just already had a little talk about what neurofeedback is with Brian Hickson, and this is a real life example of what neurofeedback can do when it comes down to it. So, so Isabella, when we had some ADHD kind of symptoms, you really struggled in terms of what? What did you struggle with at school?
I struggled with sitting down because I noticed I constantly had to stand up. I constantly went underneath tables. Like, I could not sit still.
Yeah.
I have also once actually ran out of my class because I could not stay in one spot. Also, my handwriting was horrible. It's like, no.
It was good and stand, right? Very messy, very not careful. She couldn't control her hand.
Yeah.
Make her erase and do it again. It was bad the same way.
That's something most people think about ADHD and how you can have some difficulty with even occupational therapy, right?
Oh, we try everything.
Yeah, you did, and
I tried everything.
And she really did. I gotta tell you, we did functional medicine in the beginning, and we did a lot of things working on the gut and giving supplements.
Yep.
What else do you remember?
No, I have tried the occupational therapy with her, psychologist sessions. I did acupuncture, everything.
Yeah,
we
you
did
went to the AIM
brain
Center,
balance.
I remember. You did brain balance.
Brain balance. The brain balance help from her. She used to put everything in her mouth. Like 9 years old, she would have to touch everything and put everything in her mouth.
Right.
Always like with something. And they said she had like a 2 years old brain. She was 9 with a 2 years old. They had to touch everything. It was crazy. Now, thank God, oh my God, it's a huge difference.
So ADHD, you don't have just one area of life that it affects you. So school was an effect, like you're saying.
School.
She couldn't finish nothing that she started. She would start something and would leave in the middle, and then start another thing, and then start another thing.
Yeah, I'll get distracted really easily.
Oh yeah.
So and so we went to AIM Center. I know you did all these different brain imaging, and then you had something different.
Oh my God, yes.
Yeah. So tell me about that. What was that experience for you? What did they do to you? How did you feel? And what did you notice?
Basically, they just exercised my brain, helped out, and
The therapy. Remember they put the sensors?
yeah,
to make.
the sensors.
But how you feel after? Once you're done, she did only 20 sessions.
Yeah.
I felt calmer, which was something I never feel. I felt calmer.
You stopped taking the medication?
So yeah, even with Isabella, it's one of the very few patients I have that was actually on medications. We had to. So it's not
very
like
low dosage.
yeah,
right?
we put it on a low dose, but sometimes you need it. You just we want to make sure that we don't fail. So you were actually one of the very few people I have on medication, and despite that, we really were trying. And this is the testament to you that you did every single thing, and then found neurofeedback. And do you want to explain what they did? They put something on your head.
Yeah. So they put sensors on my head. And they would hook you up to the TV thing, and it would have video games, and if you start either going to sleep or something like that, you get distracted, the video game will start going black and turning off, and then once you're focused again, it will the character will stop moving again. So it's basically you were playing a video game with your mind.
So you're playing a video game, and how long were the sessions for you?
30 minutes.
30 minutes.
How often did you have to come in?
Oh, I did 3 times a week.
3 times a week for 20 sessions.
20 sessions.
And then what happened? Because I remember you sending me a text, and I saw a piece of paper with your pre-handwriting.
Oh, yeah.
Right? It was almost like writing with your offhand. So if you're right handed, you're writing with the left hand. It was all over the place. And then, after the 20 sessions, it was like perfection. I could honestly not believe
No, I couldn't
the
believe it.
difference that made, and that really
Yeah.
got me into neurofeedback.
She did a treatment at the end of 6th grade.
Yeah.
Was ending. Last ones, I have to go home to do homework with her. I have a tutor with her every single day. If not, she will not do her work.
Yeah.
By the end, she started doing the neurofeedback. She started like sitting down, waiting for the teacher before she would hide it from her. She was sitting down, waiting, doing her thing, and then we finished the sessions, and then was the summer break.
Yeah.
So she didn't touch one pencil, like she didn't write nothing the whole summer.
Wow.
Like free for school, didn't do nothing.
Yeah.
She went back to school, 7th grade. She came on the first day from school. Mom, look my writing. I said, what? Who did that, Isabella? I can't believe, who did that? It was not you. She's like, it was me, look how I'm writing. Like perfect, rounded, so careful. I could not believe.
Yeah.
I couldn't. Her room organized. She never made a bed before. Organized everything in the right place. Her outfit was folded for her to use next day.
You're gonna
I
get
couldn't believe it.
everyone
Wasn't
very
like a kid.
excited.
Somebody like
I
changed
think
her.
people are gonna be lining up right now.
No,
Like
it
my
is. I
teenagers
tell, I
to
have
do
all
that
that
because I want
time.
some organized room.
No, it's unbelievable. I couldn't believe it. I said, oh my goodness, everything in the right place. And now she's able to sit down and do her work. Before I have to be there. If I stand up, she stand up. So I have to be there. Now she can when she wants. Sometimes she don't want to do. It's not happening yet.
20 more sessions coming. Be
Yeah, I
careful
need to get her more.
if you don't do it.
But now she can do.
Yeah.
If she hadn't, you know, she has to do. She sits down, she focuses, she does it.
Yeah, and I also remember that was right around the time that we actually took you off your medication. What happened to your, what happened to your grades? What happened to your concentration?
My grades went up a bit more. My concentration, that was a completely different story. Like that was perfect. I could actually pay attention in class, and I remember like I think we asked my teacher like to guess if I was on the medication or not.
Mm-hmm.
Yeah, cause like I was able to like act like I was on the medication without it.
Yeah.
Yeah, and then
Now it's on video, so.
But she felt so bad before when she had medication.
And,
But she would tell me,
it's
"No, I don't
interesting
want
when you say that, and it's like a nuance because, almost like the teachers expect you. I think that's why you said that, we're acting like we're on medication when we're not,
Yeah.
because then people judge you differently. So if they think that you are,
Yeah.
and now you have a whole different disposition,
yeah.
they don't start looking for things that are wrong. That's interesting. I didn't
Yeah.
think about that.
Yeah,
So it sounds like your life changed a little bit.
yeah.
Yeah.
And the difference is when I was on the medication, I did not feel like myself.
Mm-hmm.
Like I used to be like before the medication, like I had fun, even though like I was going crazy with like the ADHD.
Mhm.
Like I was so fun with the medication, like I had no personality. And then after after like the brain thing, I actually got my personality back, and I was not that crazy with ADHD. But like I was able to focus, and I had my personality at the same exact time.
Wow, look at you, and you're so well spoken, and your energy is wonderful. The smile is fantastic. I think you've grown 5 inches since that. So I mean, like again, we're not anti-medicine. This is not about that. But most people don't think about alternatives, and I think sometimes, if your brain is being, it's obviously, neurofeedback, as Brian had mentioned, is looking for a focal area that's creating some deficits. If that's already in high wire, a lot of times even the things that we recommend don't work. They don't work until we can quiet that down. So you're like the most amazing example of an alternative therapy that is not well known and not talked about a lot.
Yeah.
And this is one indication, when it comes down to ADHD, and this is why I recommend everyone to get an assessment, because you don't know if the kids fell on their heads when they're 2 or 3. You don't know how our brain compensates, because we need to function, and when we function, we do well, but there may be some level of dysfunction that happens, right? And these kids fall all the time, and we don't have any way of sort of figuring that out. If that, something 7 years ago, 10 years ago can create compensation type of way. So what, that's, now you're in, starting high school soon.
Yeah.
That's very exciting. And are we excited?
Yes.
Yeah? I thought.
I want to stay at home for high school. I want to keep her at home.
Yeah.
Nah.
And even with COVID and all the Zoom, you're still handling things really well with your concentration. I'm proud of you. We were talking about. So yeah. Anything else you guys want to share about your experience? I mean, I think that it's just such a beautiful experience. It's so different. It's something that I think everyone should know about because I think medication should be a last approach.
Last
which
thing.
again for you it was too. We really tried everything.
Oh,
And other than of course there's omegas, there's mushrooms, there's lots of things, but I think if the brain is already too high wired and it can't focus in the right space, everyone should sort of think about this as an option or evaluation to see where we go.
You need to try. We try everything. This is the one that it changed. It changed 100%. Oh my God! It's another person. Thank God. Teenage and calm. I couldn't be better.
All right, awesome guys, love it. Good job.
Perfect. Wow.